Most beautiful things in the world cannot be seen or even touched. They must be felt with the heart, says Helen Keller. A very good evening to all the participants of this meet on a breezy weekend. The heart is one organ that works continuously from the time even when we are in the womb till the last minute. When abuse is put on the body, the heart's performance is not at its best. The heart is a major organ that needs love and care. Everyone has only one, and by abusing it, they are cutting their lifespan little by little. People can live their lives freely, but how they choose to live them could be the difference between life and death. We all know that the World Heart Day is celebrated every year on 29 September. So this time is so apt to talk about heart and to hear from someone like Dr. Binoy John, who is an expert in that field. And he is going to talk about how to take good care of it. So first, let's start off our meeting with the call of a president.
Rotary Club of Raipeta, speaker meeting called to order.
Reggie, mute everyone.
Yeah, sure.
First, let's start off our meeting with a heart-touching rendition of Invocation song by our bubbliest Annette Srinika. Srinika, the stage is yours.
Thank you. Shri Garnanath Sinduravarna Karuna Sakara Karivadana Lambodara Kumikara Amba Sutta Amara Vinota Lambodara Lakumikara Siddhacharana Gana Sevita Siddhivinayaka Teye Namo Namo Lambodara Lakumikara Sakara Vidya Adi Pujita Sarvotama Teye Namo Namo Lambodara Lakumikara. Thank you.
Thank you, Srinika. It's always a pleasure to hear you. Now, shall we have a small video of the Rotary International 4-way test?
Reggie, can you make me a host as well so that I can share the screen?
The 4-way test of the things we think, say, or do. First, is it the truth? Second, is it fair to all concerned? Third, will it build goodwill and better friendships? Fourth, will it be beneficial to all concerned?
Thank you. I hope this meet is one which would perfectly align with the four-way test of a Rotary. Now, can I request our president to give the welcome address?
Thank you, Ansita, for the opportunity. A warm welcome to our eminent speaker of the day, Dr. Binoy John, fellow Rotarians of RC Royapeta, ANS, ANITS, co-presidents who I see, a few of them I can see here also on the call, and invited guests also. Non-communicable diseases, especially those diseases on account of lifestyle, are considered as the next big health threat, especially in developing countries like India. And India is supposed to be topping that list. It's predicted to be one of those on the high list in the years to come. Taking early corrective actions will significantly lower our and our family's risks to BP, heart, and other NCDs. In line with all your feedbacks, our club service team have organized an excellent session to give us an awareness on this. Dr. Binoy John, who's with us, is a regular on TV shows, a very popular doctor, and an avid smooth singer. I'm as excited to hear him as much as all of you. A warm welcome once again to all of you. Thank you.
Thank you, President Reddy. Now, may I request Anne Priya to give to introduce the chief guest?
Good evening. It is my privilege to introduce our speaker for today, Dr. Binoy John. Dr. Binoy John is a senior consultant interventional cardiologist and specialist in heart failure and advanced cardiac diseases. The letters of the alphabet pale in comparison to the number of degrees and fellowships that adorn Dr. John's resume. He was trained in heart failure and cardiac transplant medicine at Cedars Sinai Medical Center, Beverly Hills, Los Angeles. He's a former director and head of cardiology at Mayotte International and Dr. Rila Institute and Medical Center, Chennai. He's also a former consultant with Narayana Hridayalaya, Bangalore, Apollo Hospital, Triple M Hospital, and Frontier Lifeline Hospitals, Chennai. Dr. John has performed complex coronary interventions such as angioplasty of blocks and bypass surgery, including device therapy for heart failure using pacemakers and implantable cardioverter defibrillators. He's also performed balloon valvotomy in term pregnant women. He's an examiner in cardiology on the rolls of the National Board, New Delhi, and an invited speaker at international conferences. He was the recipient of the award for Best Interventional Cardiologist, Tamil Nadu, for 2020 at Vigyan Bhavan, New Delhi. In his free time, Dr. John likes to educate the public on lifestyle disorders, their prevention, and other cardiac diseases. He's written many articles and made health videos available on YouTube and Facebook. Dr. John is a patron of many charities, especially in the fields of education and development. He's a good singer and has recorded many songs in Smule and is very active on social media. Ladies and gentlemen, let me welcome our distinguished speaker for today, Dr. Binoy John. We're really lucky to have him in our midst. Dr. John, the floor is all yours now. Thank you.
And Sita, incidentally, we have Dr. Vasudha, who happens to be the district chair for disease prevention and treatment. Welcome, Dr. Vasudha.
Welcome, Dr. Vasudha. It's a great pleasure having you in our meet. Let's wait no more, Doctor. The floor is all yours, Doctor. Dr. Binoy John is here. Sir, Doctor, you have to unmute, Doctor. Doctor, you have to unmute.
Yeah, okay, sure.
Yeah.
Okay, good evening, dear President Raji, Secretary Raghunathan, Subramaniam ji, and the members of the Rotary Club Royapeta, and ladies and gentlemen. I'm truly honored to be invited to give this talk. In my practice as an interventional cardiologist, I have always been pained to see many patients landing up with heart attacks and heart failure and complications of hypertension and various heart diseases, most of which could have been prevented by regular checkups and early treatment. That is why I have been very proactive in my efforts to create awareness about preventive aspects of many diseases besides their treatment options. What I have noticed in India is many people land up in the hospitals at 50s and 60s with heart attacks or strokes. And when I ask the family about the patient's history, they say with pride, "Doctor, he hasn't entered a hospital or consulted a doctor ever in his life. This is the first time." Sadly, many times it turns out to be the last time too. That's why I would like to stress upon the preventive aspects and the need for getting periodic checkup with a doctor before irreversible damage occurs. I generally don't like to scare my patients, but in India, people are very casual about their health. And I always believe health is an investment as it is a life. So now coming to the topic, what is hypertension? Hypertension means high blood pressure. So what is blood pressure? The heart, as you know, has 4 chambers: the right atrium, the left atrium, the right ventricle, and the left ventricle. And the left ventricle is the main chamber pump. And its job is to pump blood via arteries to different organs and tissues of the body, thus supplying the organs with oxygen and energy. So the blood, as it flows through the arteries, it exerts a pressure on the walls, which is called as blood pressure. When this blood pressure is higher than normal, it is called hypertension. Hypertension is called a silent killer. When you come to the statistics, globally, it affects around 1.13 billion people. And in India, 200 million people are affected by hypertension. And in India, it causes around 1.6 million deaths every year. The prevalence of hypertension is more in men than in women, affecting 1 in 4 men and 1 in 5 women. But as age advances, this gap becomes narrower. But still, at any age, male people are affected more than women. Now, to understand hypertension, you need to know the classification. Blood pressure is measured using an instrument that is called sphygmomanometer. And the blood pressure is represented by 2 values. There is an upper reading and a lower reading. The upper reading or the higher reading is called systolic blood pressure, which represents the pressure in the arteries when the heart is contracting or pumping. And the lower reading is called the diastolic blood pressure, which represents the pressure in the arteries when the heart muscle is relaxing. The American College of Cardiology and American Heart Association have classified blood pressure into various stages. The normal blood pressure now is considered to be less than 120/80. And it is called stage 2 hypertension when the blood pressure is more than 140/90. And between 130/80 and 140/90, it is called stage 1 hypertension. There is also a new classification which has been brought in, that is called elevated blood pressure. It is not considered as hypertension. It is basically when the reading is between 120 and 129. The systolic is between 120 and 129, and diastolic is less than 80. It is called as elevated blood pressure. This is not a condition or a reading where you need to take medications, but it is an alert or caution that you have to start worrying about developing hypertension in the future, and you have to make lifestyle modifications. Then there are various other clinical categories where it is called resistant hypertension. When you need more than 3 drugs, more than 4 drugs to control blood pressure, it is called resistant hypertension. And it is called refractory hypertension, even when 5 drugs you can't control the hypertension. And generally more than 180/120 is called severe hypertension. So now what is the problem with having uncontrolled blood pressure? Blood pressure causes or increases the risk of developing something called cardiovascular disease. That means it can affect the heart and the vasculature means the blood vessels. And also it can damage organs. So what are the target organ damages that can happen? It can produce, uncontrolled hypertension can produce heart attacks. It can produce bleeding inside the brain, which is called intracerebral hemorrhage, which can produce paralysis. It can produce heart failure, and it can cause kidney disease and kidney damage, which can be irreversible, which is called as end-stage renal disease. Hypertension is the second highest common cause for causing end-stage renal disease, the first being diabetes. But together, diabetes and hypertension can accelerate kidney damage. It can also produce retinal detachment and retinal bleeding and cause blindness. And what is most important is the bleeding inside the brain, the heart attacks can be fatal. So any person who has a systolic blood pressure which is more than 20 and diastolic blood pressure more than 10, they have doubled the risk of death from stroke, heart disease, and vascular disease when compared to a normal person. And also, what has to be remembered is sometimes it can produce disability in that the patient need not die, but the patient may be affected by paralysis for his entire life. That disability also has to be kept in mind. So why is hypertension called a silent killer? This is because hypertension usually starts around the age of 30s, early 30s, and it slowly progresses. It is not a sudden increase in the blood pressure. It is a phenomenon that happens over several months and several years. So the body has enough time to adjust and take corrective measures. For example, what happens is in the heart, because the heart is pumping against high pressure, the heart muscle starts thickening to counter this high pressure and supply blood to the various organs. Similarly, this high pressure can affect the other organs like the kidney, the brain, and the blood vessels. So since it is a slow process, the body has time to adjust itself and it does not produce symptoms. Often the first incident which brings the high blood pressure to notice may be a heart attack, a full-blown heart failure, or a paralytic stroke, or death itself. And this is the reason why it is called as a silent killer. The advantage of diagnosing hypertension early is that you can identify and treat it before irreversible target organ damage occurs. So, what are the risk factors of hypertension? The risk factors of hypertension can be classified as fixed risk factors and modifiable risk factors. Hypertension in the earlier days, it was called as essential hypertension. Earlier days of clinical medicine, it was called essential hypertension because they found that as age advanced, blood pressure was noticed to be higher and higher. So it was called as essential hypertension, then that it is a part of life. But later they found out that it is dangerous, and now essential hypertension is called as primary hypertension. Primary hypertension has got a genetic predisposition and it can run in families. And like I told you earlier, male gender is prone to hypertension than females. So age, male gender, and genetic predisposition are called fixed risk factors. You can't change them. But luckily, there are a lot of modifiable risk factors which can be changed. For example, physical inactivity and lack of exercise has been found in clinical trials to be one of the major causes for developing hypertension. Similarly, excessive body weight, unhealthy dietary habits like taking excess of salt, consumption of excess of alcohol, all these can produce hypertension. So these are all correctable factors, and therefore they are called as modifiable risk factors. 17% of the hypertensives in the world have more than 3 modifiable risk factors, which is actually good news. Then what happens is, as a person ages, he can develop other risk factors which can cause cardiovascular disease like diabetes, high cholesterol levels, which can all be treated. And also cigarette smoking is another modifiable cardiovascular risk factor. And this includes passive smoking also, not only active smoking. So having talked about primary hypertension, there is something called secondary hypertension also. So what is secondary hypertension? Secondary hypertension is when hypertension or other diseases, hypertension occurs because of secondary causes or other diseases. For example, chronic kidney disease can result in hypertension. Hormonal disorders like thyroid diseases and sleep disorders like obstructive sleep apnea. These are all other diseases which can also cause hypertension. And then there are certain medications like chronic use of steroids, chronic use of painkillers, certain psychiatric medications like antidepressants, the use of oral contraceptive pills, and certain anti-cancer drugs. All these can produce hypertension. So the importance of identifying secondary causes or secondary hypertension is that unlike primary hypertension, the focus of treatment is aimed at treating the disease rather than the hypertension itself. But often, both need to be treated in the early stages. Now we come to another interesting thing in hypertension, which is called as white coat hypertension. White coat hypertension is a condition where when the patient comes to the clinic or to see a doctor or enters a hospital, his blood pressure goes up. But if you check it at home, it will be normal. Similarly, there is something called masked hypertension, where when the patient comes to the doctor, his blood pressure will be normal, but it will be high at home. The importance of differentiating both is because white coat hypertension, if you diagnose it to be sustained hypertension, he will end up getting wrong treatment. And masked hypertension, if you miss it, he has the same risk of developing stroke and heart attack without a doctor or physician's knowledge. So how can you identify this white coat hypertension and masked hypertension? Now, this out of office measurements are now being encouraged so that you can identify these forms of hypertension. Out of office measurements, what you do is like there are devices which are called ambulatory blood pressure monitors, where you can use that machine to automatically record the blood pressure over 24 hours. The cuff will automatically inflate and deflate, and you can set the interval. And usually during the daytime, it is set for recording blood pressure at every 15 minutes. And at night time, it can be adjusted to even half an hour or 1 hour. So by doing a 24-hour ambulatory blood pressure monitoring, you'll be able to detect white coat hypertension and masked hypertension. So what are the devices that can be used to measure blood pressure? The conventional sphygmomanometer, which has been used so far by health professionals, was the mercury devices. The mercury devices, because now mercury is considered as a biohazard, it has been stopped and it has been replaced by aneroid devices. But what is commonly used at homes is the digital devices. They are very popular because they measure the blood pressure automatically, and you don't need to have auscultatory skills with the stethoscope to record the blood pressure. So what an digital blood pressure monitor does is it has got an electronic sensor which will detect oscillations in pulsatile flow. And these are actually, the blood pressure is then indirectly calculated from certain algorithms based on population-based data. For this reason, it is very crucial that you buy only digital devices with internationally validated measurement protocols, because these are indirect measurements. So what is the right technique for measuring blood pressure, and why is it important? If the wrong technique is used to measure blood pressure, hypertension may be missed, or you may end up diagnosing hypertension in a person who is having normal blood pressure. So that is because there are several confounders with recording blood pressure. What everybody must understand is blood pressure is a variable phenomenon, and what is measured during the day will be different in the afternoon. It may be different in the night or in the evening. So immediately after an activity or an exercise or a strenuous effort, the blood pressure usually is very high. And even consumption of caffeinated drinks and smoking can elevate blood pressure. So it is very important that when you check the blood pressure, it is important that you check it after the patient has taken half an hour rest from any form of exercise, and he is off or free from caffeinated drinks and smoking for half an hour. And it is also important that the patient be seated and he should be rested for 5 minutes. And the cuff of the blood pressure sphygmomanometer should be at the level of the heart, and he should be sitting comfortably with his back well rested. This is very important. And it is also important that you use the right size of the cuff also matters. For the obese people, you have to use larger cuff. And if you use the regular cuff for very small people, that also can lead to abnormal and readings and wrong diagnosis. And also it is important that before you brand a person as hypertensive, it is important that you take at least 2 readings at a time and on 2 different occasions. So these are very, very important things to be paid attention to before branding a person as a hypertensive. So what are the tests that are usually done in a hypertensive patient? The most important step is to have a physical appearance with the specialist. His blood pressure has to be checked, and he will be usually examined by the doctor for auscultated for any sounds. And from the history, he will be able to find out or suspect any secondary causes which need to be investigated. Routinely, the kidney function, thyroid function, and to identify kidney damage, protein in the urine is very important. That is called microalbuminuria. That also will be usually checked. And for the heart per se, an ECG will be done. And an echocardiogram is also very important because that is a test where you use sound waves and you can detect, you can actually see the heart, the valves, etc., and assess the pumping function, whether the heart muscle is thickened, whether he has got heart failure, whether he has got any valvular diseases, etc. So much of information is derived from an echocardiogram. So now coming to the treatment, what is the recommended treatment target for blood pressure control? In a patient who has already had any event like a heart attack, a stroke, or kidney disease, etc., the target that is recommended is less than 130 by 80. It is important that you maintain the blood pressure less than 130 by 80. But if it is for primary prevention, that he doesn't have any other risk factors, there is a risk scoring which can be done. And if the risk scoring is shown to be high, then again you have to target less than 130 by 80. And if the risk scoring is low, the risk scoring shows that he is at low risk for developing cardiovascular disease, then he needs to maintain it under 140 by 90. So how can hypertension be controlled? There are a lot of drugs which are available which can control blood pressure. But what has to be remembered is that the choice of a drug is not a random choice. It is a very careful and fine selection which is based on the history, the age, the sex of the patient, the kidney function, the other comorbid diseases, etc. There are so many factors which are paid attention to before selecting the ideal drug for a patient. But what is most important is lifestyle modification. Whether the patient is stage 2, stage 1, or elevated blood pressure, lifestyle modification is common for all. And with lifestyle modification, what I mean is weight loss is one of the lifestyle modifications which can be achieved. There is something called body mass index, which is an index which can be obtained by the measurement of the patient's height and the weight. And the body mass index, which is more than 25, is said to be overweight. And when it is more than 30, it is said to be obese. The ideal target to be maintained is 18.5 to 24.9. Closer to 18.5 would be recommended. So every kilogram loss can reduce blood pressure by 1 millimeter of mercury. And physical activity is very important. And it has been shown in clinical studies that a sedentary lifestyle can elevate blood pressure. And it has been proven that physical activity has a very good blood pressure lowering effect. And generally what is recommended is 150 minutes per week of moderate dynamic exercise, or it can be 75 minutes of vigorous exercise. Now, a healthy diet is very important. And you can hear of several diet plans which are being discussed on social media, WhatsApp, etc. But there is only one dietary pattern which has been proven in clinical trials to be effective in reducing hypertension, and that is called the DASH diet. That is dietary approaches to stop hypertension. The DASH diet recommends that you consume a diet which is rich in fruits, vegetables, whole grains, reduce the total fat consumption, and reduce the total amount of saturated fat intake, and have more of potassium in the diet. This is known to reduce, having a healthy diet can bring down blood pressure significantly. Sodium restriction is very important because sodium is one element which can retain water in the blood vessels, and that is why it causes elevation in blood pressure. So the recommended advice by all the heart bodies is that it should be restricted to less than 1,500 milligrams every day. This is, we are talking about sodium content. And it can reduce blood pressure as much as 5 millimeters of mercury. The most important thing about sodium restriction is that it can help in the efficiency of medications also by reducing the sodium content in the diet. Excess of alcohol is shown to have increased hypertension, and it also reduces the efficacy of medications. So a person who consumes more than 3 to 6 drinks per day is said to be consuming high amounts of alcohol, and it is advised these patients reduce it by 50% initially and bring it down to, for males it is less than 2 drinks per day, and for women it is less than 1 drink per day. So these are all the things about hypertension which I wanted to bring to your notice, and I will quickly touch upon heart failure. Heart failure is also a huge topic which can be discussed over days. So like I said, heart has got 4 chambers, and the left ventricle is the main pumping chamber which pumps blood, oxygen and energy to the rest of the body. The normal pumping function or ejection fraction of the left ventricle or the heart is 55 to 70%. During a strenuous activity, suppose you are running or exercising, this can go above 70%, and then it will come back to the normal pumping. So when you say heart failure, it means this normal pumping function is reduced. For easy understanding, heart failure can be divided into 3. That is mild heart failure, moderate heart failure, and severe heart failure. The actual definitions are much more complex, but I will just make it very easy for you. It is called mild heart failure when the pumping efficiency is 40 to 50%, and moderate when it is 30 to 40%, and severe heart failure when it is less than 30%. There are further categories which are called advanced heart failure and refractory heart failure also. Heart failure can occur due to various causes, and the most important cause and the commonest cause nowadays is heart attacks. Like I said, the heart is a pumping chamber, and for the heart to pump, it needs energy and blood and oxygen. So the blood is supplied to the heart mainly by 3 coronary arteries. So when there are blocks in these arteries, the patient can develop heart attack. Usually what happens is a sudden clot formation can convert a 30% or a 70% block into a 100% block, which occurs suddenly, and that is what causes a heart attack. So the treatment for this heart attack is to immediately open up the blood vessel, and the perfusion has to be reinstated as early as possible. And if it is done within the golden hour of 1 hour, it is the best, and the heart pumping can recover, because the heart muscle, unlike the liver, does not regenerate. Once some damage happens, it is likely to be permanent, and the earlier a heart attack is attended to, you can prevent a heart attack and heart failure from occurring. There are other important causes like congenital heart diseases by birth defects, and there are valvular heart diseases like leaks in the valves, blocks in the valves, etc. can produce heart failure, and most of them are correctable if you identify it early. Pregnancy also can produce heart failure in women, and then there are certain familial diseases like diseases of the heart muscle per se, which are called amyloidosis, hypertrophic cardiomyopathy, etc. And there are certain drugs like anti-cancer drugs which can produce heart failure, and drug abuse from cocaine can produce heart failure. There are nutritional deficiencies like thiamine deficiency can produce heart failure. Certain viral diseases can affect the heart by a process called myocarditis and can produce heart failure. Alcohol is one of the commonest causes for heart failure, and it is a reversible cause. And what we must understand is 26 million people are there all over the world who suffer from heart failure. And in India, it is around 1.3 to 4.6 million. And every year, 0.5 million to 1.8 million new cases are added in the country. So what are the symptoms of heart failure? The most important thing to remember about heart failure is it is a progressive condition. Once a patient ends up with mild heart failure, it is only a matter of time that it progresses and ends up with severe heart failure. Breathlessness on walking is one of the commonest symptoms of heart failure. And as it progresses, the patient will not be able to do even activities personal activities like going to the toilet, taking bath, making the bed, dressing up. All these activities become impaired, and he starts getting breathless on such activities. And as it progresses, he may end up with heart failure and breathlessness at rest also. He is not even able to lie down properly, and even lying down becomes difficult for him. because fluid starts accumulating in the lungs. And then, as I told you, the function of the heart is to pump blood forwards. When the heart failure occurs, what happens is back pressure starts building up, and fluid starts accumulating in the lungs. And behind the lungs is the right ventricle and the veins of the body. And the pressure in the veins and the right side of the heart also start going up. And the patient starts developing swelling of the feet, accumulation of fluid in the stomach, etc. And another common symptom is fatigue or tiredness. This is because the other organs and muscles, etc., are not getting enough of blood and oxygen because of heart failure. And then what happens is because of the lack of oxygen, the muscles start getting fatigued very easily. Kidney perfusion also can get affected, and this is called as cardiorenal syndrome, and kidney function also starts deteriorating with heart failure. So basically, the quality of life is affected, and over time, the patient will start needing hospitalization for management, where he will need external oxygen supply, ventilators, and also IV drugs to manage heart failure. And then the patient ends up finally with refractory heart failure. Heart failure has got 4 stages. Stage A, B, C, and D. Stage A is the 5-year survival is very good. It is 97%. And with stage B, the 5-year survival is 96%. With stage C, it comes down to 75%. And with stage D heart failure, the 5-year survival comes to as low as 20%. So what is the treatment? Though morbidity is high and inevitable progression of heart failure is a rule, prompt treatment can definitely delay the progression of heart failure from stage A to B, B to C, and C to D. A lot of excellent medications are available, and one of the mainstays for treatment is salt and water restriction. But unlike other conditions like fever, etc., which can be managed on the phone, heart failure is not a condition which can be managed on the phone, and it needs personal presence of the patient in the specialist clinic, because there is a lot of information that needs to be derived, like the blood pressure, the heart rate, the lung, the auscultation. I mean, the lungs have to be checked whether there are any fluids, the amount of swelling, the weight of the patient, etc., are all very important in managing or deciding the treatment. And most importantly, the echocardiogram is the most important test, which needs to be followed up serially for titration of medications and choice of medicines. The kidney function and liver function also become very important. So there are a lot of other advanced treatments also, like what happens in heart failure is, heart usually when it pumps in unison. In heart failure, what happens is, with the progression of time, when one part of the wall contracts, the other part of the wall moves away. So there is no synchrony in contraction. So there is a pacemaker which is called as cardiac resynchronization therapy or biventricular pacing, where you can put electrical wires into the different walls and make the heart contract in unison, and therefore thereby improve the heart failure and improve the quality of life. One of the commonest causes of death in heart failure is sudden death. This is because of sudden arrhythmias occurring. That is, the heart beats very fast at the rate of 150, 200, 250, etc. And if these patients need to be treated, they have to be shocked immediately so that the normal rhythm comes back. If shocking is not done within 2 minutes, the patient can die. So that is why there is a treatment called ICD, or implantable cardioverter defibrillator, where you can place a lead inside the heart, and there is a machine or a generator which will give the shock as soon as it detects the arrhythmia. So this is one very effective treatment where sudden death can be prevented. Of course, the gold standard for treatment of heart failure is nothing but heart transplant, and heart transplant gives very good quality of life. And the 1-year survival after heart transplant is 90%, 5-year survival is 71%, 10-year survival is 50%, and 20-year survival is as good as 20%. But unfortunately, the problem with heart transplant is there is a paucity of donors. It is not easy to get a good heart for transplant. And world over, in a year, the number of transplants that happens is only 3,800 to 4,600. Not all patients are eligible for heart transplant, and those who are ineligible, there are machines which are called LV assist devices, which are surgically implanted in the heart, and it does the function of a heart. And this machine is driven by external batteries which are rechargeable, and the patient can lead a relatively very good quality of life. But then there are other problems associated with it, which is beyond the scope of this discussion. So what I meant is there are a lot of treatment options available for heart failure currently. But heart failure being a very morbid disease and with inevitable mortality, what I would like to stress is preventive care. Like if you identify hypertension, if you identify diabetes, if you identify blocks, etc., very early, all these causes of heart failure can be prevented. And so this is one of the conditions where the medical conditions where the age-old proverb of prevention is better than cure holds good in medical practice. Thank you.
Thank you, doctor. That was wonderful. So there's a lot of information about different types of hypertension, and then and also in terms of different ways it would affect the heart, and also you touched upon different heart ailments, and also the other elements within the body which may also get impacted because of that. So so let me now open it up for any questions, and then please do type in any questions if you have for the doctor.
President
Ravi Shankar, there was a question from which Mr. Ravi Shankar wanted to ask.
Good evening, doctor.
Good evening.
This is President Ravi Shankar from Rotary Club of Madras Bay City.
Hello, sir.
Hello, sir. I have a small question to you, doctor. What is the difference between hypertension and a palpitation in the heart?
Hypertension is basically a diagnosis. It is a condition.
Okay.
Whereas palpitation is a symptom, like you complain of pain or you complain of fever, it is a symptom. It is not a condition.
Okay.
Palpitation just means you can feel the heart pounding inside your body. That is the meaning of palpitation.
But
Palpitation can be normal also. Very thin individuals, when they run, they can feel their heart hitting against the chest. That is a normal thing. Whereas pathological palpitation is when suddenly the heartbeat goes very high. Like I told you, the normal heartbeat range is around 70 to 100. But suddenly for no reason, it starts going very high in the range of 150, etc. Then it could be pathological. But running can cause heartbeat to go up, and that time the palpitation is said to be normal. So basically palpitation is a symptom. It is not a condition. Hypertension is a condition. It's a diagnosis. Whereas palpitation is a symptom.
Only one question, doctor. See, last 6 years I am living with palpitation. See, normally my heartbeat, whenever I feel the breathing problem, I immediately go to a cardiologist. They take an ECG. First time when I went to Malar Hospital, my heartbeat was 220. The ECG is available with me.
How much?
220. And they have given me a shot. Yeah, they given me a shot, put me into ICU for 3 days, and they brought me to normal. Dr. Mohan was the cardiologist at Malar.
So is it like, is it basically, did they diagnose you as supraventricular tachycardia, SVT?
Exactly, but no pain. I never had any pain. As you said, it was hitting to my chest. That's all.
That is why I told you, pain is a different symptom. Palpitation is a symptom. It is a feeling. It is not a diagnosis. So pain can be usually produced because of heart attack or some other causes. And palpitation is a different symptom altogether.
So now I want to ask you one question, sir. You are saying that you have to go for a lung test, echo, LFT, and kidney function. Normally, I go for echo. Whenever I go for a ECG, I go for an echo. Is that now required to go for a lung function and LFT, sir?
Lung function, we don't usually check for palpitation.
Okay.
You are talking about LFT? You are talking basically for your palpitation, right?
Exactly.
See, basically, we need to find out why you had that supraventricular tachycardia. Because it is uncommon for a person just to develop supraventricular tachycardia just like that. So usually what we do is we start them on the drug which is called beta blocker. And the person will have to, and you have to rule out diseases like thyroid. Thyroid toxicosis can produce palpitations. Sometimes low hemoglobin can produce palpitation. You have to rule out all the treatable causes. And then there is usually what we do is we give a drug which is called beta blocker. And usually if the patient is taking beta blocker, the palpitation or supraventricular tachycardia does not recur. But there are certain people who cannot tolerate high doses of beta blocker. In those patients, or sometimes in spite of taking it, the supraventricular tachycardia can recur. In those patients, what we recommend is there is a study which is called electrophysiological study or EP study, where you can put catheters inside the heart and find out from this can be because of abnormal, the heart has got a battery and wires inside the heart. Sometimes by birth, there may be abnormal wires present which can be suddenly activated. And you can identify that wire by EP study. And there is a treatment which is called radio frequency ablation, where you can pass a radio frequency current and then ablate that, just cut off that wire. Then this SVT does not recur again.
I'm just taking the scalapin 40 and Angsit 0.5. That's what been recommended by the doctor.
Yeah,
is that right?
That is another variant of the beta blocker. I don't know the reason why they gave you calaptin, but beta blocker is also one of the commoner drugs which are used.
Okay. Thank you, doctor. Thank you.
Pleasure.
Thank you, Raji.
Yeah, we have few more questions here, doctor.
Sure.
Rotarian Pari, he has a question. Rotarian Pari, can you please ask?
Yeah. Good evening, doctor. This is Pari from Rotary Club of
Good evening, sir.
Yeah, sir. Recently, 2-3 days back, I read a news saying that the normal readings for blood pressure is now they have increased from 120 to 82, 130 to 90, and many discussion going on. US still they are retaining 120/80, whereas in India above 60 means 130/90 is acceptable, and below 60 it is. So who is deciding all this? Which is normal, which is not normal, and who decides all this, doctor?
Okay. See, basically, the clinical medicine which is practiced, it is called evidence-based medicine. So these are not random figures. What happens is in America, the body that controls all this analysis. This is called meta-analysis. They will gather all the trials which have been done in different parts of the country, or even sometimes there are multinational trials also. They gather all this information periodically. And there is a big committee which includes cardiologists, nephrologists, diabetologists, a lot of people will be there. And these are all experts in their field. And statisticians, everybody will go through this field. And like I told you, hypertension, in the earlier days, it was called as essential hypertension. They thought it was part of life. But then they found out when blood pressure was poorly controlled, patients were developing heart failure, patients were developing heart attacks, patients were developing strokes. So they brought down a level from the evidence that was available at that time. If suppose that time the diagnosis of hypertension was placed at 140/90, they found out that even in spite of controlling 140, that is after that, the further trials which are done after 140/90, they found out that still strokes, heart attacks, etc. are happening. So what they do is they try to control it even better. And then they find that there are definite mortality reduction. That means less people are dying because of better control and better control of blood pressure. So that is how they bring down the targets by evidence-based medicine. These are all not random figures. Now what happens is there are a lot of bodies. America has got American Society of American Hypertensive Society, American Heart Association, American College of Cardiology. Similarly, Europe has got European Society of Cardiology. India has got Indian Hypertension Society also. So these are all based on regional evidences. So it depends on whether you want to follow European Society guidelines or you want to follow American Society guidelines. But generally, the principle is that the better you control blood pressure, the lower the chances are that you are going to end up with heart failure, heart attacks, and strokes. So that is why it is a periodic analysis by which these guidelines are bringing it into better control and keep it as normal as possible. Because definitely 120/80 is the normal blood pressure which everybody has. Once it starts increasing, they have identified that clearly the target organ damage is happening. That means kidney is getting damaged, heart is getting damaged, strokes are happening. So these are all based on statistical and evidence-based medicine, that all these guidelines decide the numbers.
Thank you, doctor.
My pleasure.
Thank you, doctor. There is another question here from Anthony. He is asking, like, what is the relation between fatty liver and heart failure?
Fatty liver and heart failure do not have any connection. The only connection you can think of is if you take too much of alcohol, that can produce fatty liver and that can produce heart failure also. Otherwise, there is no direct connection between fatty liver and heart failure. But what can happen is a person who develops heart failure, like I told you, the pressure inside the heart chamber start going higher and higher. So heart failure starts on the left ventricle, and this high pressure is conveyed to the left atrium, which is conveyed behind. Behind is the lungs, and from the lungs the high pressure is conveyed to the right side of the heart. Now the liver is connected to the right side of the heart. So what happens is that high pressure in the right side of the heart can get conveyed to the liver, and that is a cause for cirrhosis, but it does not produce fatty liver. Fatty liver is usually because of dietary problems or because of excess alcohol consumption, and plus there are other causes also. But that is fatty liver is a cause to produce liver failure more than heart failure.
Oh, thank you, doctor. And here's another question asking the difference between heart attack and cardiac arrest.
Okay, cardiac arrest just means the heart is stopping to beat. So everybody dies because of cardiac arrest. Finally, the heart has to stop. That is cardiac arrest. And cardiac arrest is not a diagnosis. That is a final stage of any form of death. If you shoot a person also, that person, when he dies, his heart has to stop. That is called cardiac arrest. But heart attack means, I told you, the heart.
So you are muted, doctor. Yeah.
So basically, heart is a pumping chamber, and the heart also needs energy in the form of blood, oxygen, and nutrients for it to pump actively. And this blood is supplied by 3 arteries, which are called the coronary arteries. When blocks develop inside these coronary arteries, and suddenly that block becomes a 100% block with the development of blood clot, that is what causes a heart attack. So in a heart attack, what is happening is the heart muscle, the blood supply is getting suddenly cut down. And depending on which artery heart attack is happening, the muscle damage may be very huge or it may be very minor. If it is a small branch is affected and causing the heart attack, the injury to the heart muscle is small. But sometimes one of the major arteries of the heart is called the left anterior descending artery. If that gets, if a heart attack involves the left anterior descending, a huge territory of the heart muscle gets affected. And because of the sudden reduction in blood supply, what happens is, I told you about that arrhythmias, ventricular tachycardia and ventricular fibrillation. The normal heartbeat range is 60 to 100. What happens is the rate goes up to 200 and above. And so the heart is not able to pump. It just vibrates like this. So what happens is the brain does not get blood. And when the brain does not get blood, the heart naturally stops. That is cardiac arrest. So cardiac arrest is the end stage for a lot of causes, whereas heart attack is one of the causes for cardiac arrest.
Okay. Thank you, doctor. Thank you.
Yeah.
And here's another question. How long can a heart patient having 2 stents do cycling? Can it exceed 50 kilometers if he or she feels it comfortable to do?
It is not like that. There is a calculation. If you ask very scientifically, what has to be done is 220 minus age. That is what is called the target heart rate or maximal heart rate. And what can be done is your heart rate target. There is a target range where there is a where you should not exceed. That is usually 75% of that heart rate is what is recommended as the upper range. And actually, there is something called heart rate reserve also. That is from this. It is a calculation. 220 minus age will give you the maximal heart rate, and then you have to subtract the resting heart rate. For example, let us say somebody is 50 years old. So 220 minus 50 will be the target heart rate, which is 170. From this, you have to subtract your resting heart rate. Resting heart rate means as soon as you get up from bed, before you start any activity, you have to record your heart rate. That is called the resting heart rate. When you subtract, say that is around, let us say that is 70. So 170 minus 70 will give you 100. So 75% of this plus resting heart rate will give you the upper limit of how much you can exercise. Will give you the lower limit, the range in which you can exercise. So basically, for a good cardiac exercise, what is most important is you need to increase your heart rate. If it does not increase, if you do not increase your heart rate, or if that particular exercise does not increase your heart rate to this range, it is not a cardiac exercise at all. So the thing is, you can take my number. If you have any personal detailed questions, I can explain it on the phone. You can find it on Google. My number is there, available on Facebook, YouTube, everywhere. Hello.
Sashish.
Thank you.
Yeah. Thank you so much, Doctor. Here's our Rotarian Sashi Suresh. She wants to. She has some question. Sashi, madam, yeah.
Subbu, I'm also there. Please give a chance. Okay.
Good evening, doctor.
Yeah.
I'm Rotarian Sashi Suresh. See, when I get up in the morning, left hand, pain will be there. So I always get worried, like, is it because of the heart problem? Because my mom had a heart surgery twice.
Yeah, I mean, see, I am a person, see, the hand pain, there are a lot of causes for pain. So basically, like hand pain need not be cardiac pain always. But if it is coming with exertion and if it suddenly happens, then it is something of concern. But a regular hand pain can be because of position, the way you lie down, or if you use that particular hand is being used regularly to lift weights, or suppose you have cervical spondylosis. All these can produce hand pain. But any hand pain or any form of pain, if you are in the high risk category in form of age and other risk factors like diabetes, hypertension, etc., I would advise you to take medical attention and get a periodic checkup done, especially because you are having family history. Because these are all, a lot of things come to analysis of pain and finding out whether it is cardiac or non-cardiac.
Okay.
It is very difficult to tell in a casual discussion.
Okay, thank you.
Welcome.
Thank you, Doctor. Here's the Rotarian Saravanan with a question.
Yeah. Thank you, Doctor. Thanks for the detailed information on the heart care and many things. I mean, I think it's too technical too, but two questions I have on behalf of myself and the team. One is you told in your presentation 1 in 4 men and 1 in 5 women get heart disease or heart attack. In any specific reason or for the obvious reason we know? Number one. Number two, of all the presentations and the inputs you gave, so what do you suggest as the do's and don'ts for people like us? We are all common person. We are Rotarians and we work. We are basically non-medical people. So what would your suggestion for a healthy heart, and what would be the do's and don'ts?
Okay. See, I told you, like, your first question, like, the thing is, women in the pre-menopausal age group, they have this hormone called estrogen, which protects them from cardiac disease. It is in the post-menopausal phase. It is more of a hormonal effect that protects them from cardiac diseases. When the post-menopausal phase comes, then they accelerate and they start getting more of cardiac problems. So that is the explanation for that gender disparity. And for coming to your second question, I already told you, for hypertension or for any cardiac disease, for prevention, the most important thing is lifestyle modification. Lifestyle modification means, I told you that it is exercising regularly. These are all proven things with very good evidence in all clinical trials, that regular exercise for 75 to 150 minutes, depending on whether it is vigorous exercise or moderate exercise, at least 150 minutes of moderate exercise every week. Moderate exercise means brisk walk is considered a moderate exercise. So if you do brisk walk every week for 150 minutes, that is a good lifestyle modification. Then cutting down on salt and eating more of green leafy vegetables, which have got high fiber and more of fruits, and reducing the salt content in your body, in your food, and reducing the fat, total fat and saturated fats have to be reduced, and trans fats should be nil. So these are the things to be followed, and all this put together, if you have a good lifestyle, you can prevent almost all diseases. That is what I tell all my patients. So basically, you have to invest at least half an hour daily for your health. And you have to reduce the calorie intake also. That is important.
Thank you, sir. Thank you, doctor.
My pleasure.
Thank you, doctor. And here is another question. How do we improve our HDL count?
Okay, HDL count, there are certain drugs which can be used, but that is not used because they have got side effects. But generally, we don't focus on trying to improve the HDL because it is more of a genetic factor, HDL levels. In Asians, it is found to be very low, HDL. But the way we can improve HDL is eating fish, and then almonds can elevate this thing, HDL levels. And there is something which is shown to increase HDL, which I wouldn't advise, that is consumption of alcohol. And exercise, regular exercise can increase HDL levels.
Okay, thank you, doctor. And here's a question, like, what does a low heart rate indicate? For example, 35, what does it indicate?
Heart rate less than 60 is called sinus bradycardia. The heart, I told you, the heart has got a wiring inside that is called the pacemaker, and there are actual wires inside the heart. From the battery, which is called the sinoatrial node, that is the one which generates the heart impulses. So normal heart range in a normal person will be around 60 to 100. So it can go up more than 100, then it is called sinus tachycardia for several reasons. If you run also, it can go high, more than 100, then it is called sinus tachycardia. Sinus bradycardia can also occur because of so many causes. It can occur because there are a lot of causes for sinus bradycardia. It has to be basically evaluated. One of the commonest causes, there are people who are put on drugs, medications for hypertension that can produce low heart rate. Thyroid disease can produce low heart rate. And another Rotarian was mentioning, he was taking a medicine called verapamil or calaptin that can also reduce heart rate. So there are a lot of drugs which can produce low heart rate. But sometimes what happens is, because of some diseases, this pacemaker or the sinoatrial node, the pacemaker or battery of our heart, that can degenerate. That can degenerate with age or because of some unknown causes. And then the number of impulses, which is normally 60 to 100, may not be generated. That is because of, like any battery of a clock. As time goes by, the battery gets weak, the clock will slow down. So it is the same thing which happens in the heart also. As the battery becomes weak, the number of impulses generated becomes weak and lower.
Thank you, doctor.
Yeah.
Any more questions?
There's a pain in wrist.
Okay, that she asked. And somebody is asking about a suggestion for good oil. Yeah. Dr. Senthil, please.
Yeah. Sir, Dr. Binoy John, is a wonderful presentation from your side, and is very informative too. So I want to ask you one question regarding because we are preparing a regular kitchen oil, which is the best oil for the heart? Because we are,
yeah, I understood, but I am not an expert in cooking or in oil. But the general advice, I can give you guidelines by which you can select your oil. So when you select your oil, what you have to see is whether there are trans fats. I would recommend that trans fats be 0. And the saturated fats should be as low as possible. And polyunsaturated fats and monounsaturated fats should be high. So this is the way by which you can you should select your oil. Saturated fat, total saturated fat should be low, and trans fats should be 0.
Thank you, sir.
Yeah.
Thank you. Very good information.
Thank you, doctor. Any further questions?
Dr. Binoy John, incidentally, your friend Shaji Varghese is also on the call.
Hi, Binoy.
Hi.
How are you?
Fine, fine. Oh, Shaji, how are you?
Good, good. One question I would like to ask, probably it is going to help a lot of guys. Is as you get up in the morning, many of them have this habit of having this tablet before their exercise routine or something. Is that a good practice or a bad practice?
What tablet are you talking about?
They generally get that one tablet to control the BP, blood pressure, or the
You're talking about antihypertensive drugs.
Yes.
It is always better to take it as soon as you wake up, because as soon as you wake up is when the usual surge in blood pressure happens. After a good sleep, when you get up, BP generally shoots up. So it is generally advised to have the medication early, especially if you are planning to do any workout, because the pressure in the brain should not go up and produce some stroke or something. So it is important to keep your blood pressure under control when you are planning to exercise, especially when you are planning to lift weights, etc.
Okay, thank you.
Yeah.
I will call you later.
Yeah, sure, sure.
Any other questions from any Rotarians? On blood pressure or in you probably last two more questions if we have, so we can before we wind up. Okay.
Subbu, last question, okay?
Yeah. No worries. Go ahead.
Yeah. Doctor, how often should we test thyroid if we have thyroid and I'm taking the tablet? How often should we check?
I mean, at least once in, it depends on what level of control you are. Suppose it is already well controlled, then you need to check probably once in a year or once in 6 months. That again is dependent on your, we can pick up the signs of a good control from an ECG or by simply auscultating your heart rate. We can find out whether it is on good control or bad control. Okay. So generally for follow-up, probably 6 months or once a year should be good enough, if it is already under control.
Okay. Thank you, doctor. Thank you.
Before we end, doctor, with the current pandemic, is there some relation to the virus and the heart? Is in any way, the post thing after virus affects someone? Is there
okay? As of now, there is no evidence that any organ other than the lung is affected directly by the virus. Okay. That is very clear, and I think I have written 2 articles already on COVID and the heart. It is available on Google. 2 articles are available. As of now, there is no evidence that the virus directly affects the heart, although there are certain anecdotal reports coming. And the thing is, the heart can get affected only if a cytokine storm happens. Cytokine storm means like it is an hyperimmune response by the body. It releases a lot of chemicals. If that chemicals are released, what can happen is the blood pressure can go down. And once blood pressure goes down, what happens is it can affect all the organs of the body, because basically when BP is low, none of the organs are getting enough of blood supply. And another speculated mechanism is that the virus can cause something called myocarditis, but these are all not proven yet. We are waiting for more reports and information to come. As of now, there is no direct evidence of a heart being affected directly by the virus.
The hypertension, again, what you are talking now about is hypotension, is it? So where the blood pressure is lower.
Hypotension is when the upper level is less than 90, it is called as hypotension.
Okay. So that can also be caused because of the drugs which you're taking. If you already have pressure is in control and you take a
that is if the doctor has prescribed you on medicines and you are not following them regularly, you can end up with hypotension. But usually the doctor will instruct you on what all to be aware of when you are taking the medication.
Okay.
I didn't touch on the details of the treatment aspects because that is highly medical. Preventive aspects was what I touched on.
Okay. Yeah, so probably I think we don't have any questions. So let's move on with the agenda. Thank you very much. It's been wonderful, and then you have patiently answered all the questions of all the Rotarians and also the guests.
Now I request Rotarian Raghunathan to give the word of
thanks. Thank you, Ansita. Thank you, Doctor. Thank you, Dr. Binoy John. Definitely, it is a very informative and technical speak about two important aspects: hypertension and heart failure. Definitely, the two important say or words which I would like to register to every participant is prevention is better than cure. I think that is a simple word which can be more effective. And second, one important is health is wealth. Though in the modern world we work a lot for our money, but the health is one which we can't definitely get it. So health is wealth, prevention is better than cure are the two important statements given in this particular speech. Thanks for that. Coming to the this topic, speaking, definitely a lot of information in there, a lot of technical information. What is hypertension, elevated blood pressure, stage 1, lot of too much technical. Definitely, I think one important aspect which I would like to register on the prevention thing is balanced diet and activity. Daily activity would prevent a lot of such diseases. And simple language for everyone, body mass index. This is a one important aspect. As you rightly said, let us target for a BMI of 25. I think that is a simple message for all the people.
Under 25.
125. That is a simple message for everyone. Thanks for that wonderful thing. Coming to the word of thanks, Doctor, for definitely for an informative talk. And I would also like to thank President Reggie for organizing such an important topic, need of the day. I think current pandemic situation, this will give a lot of confidence for everyone. And definitely thanks to Subbu and Rotarian Subbu and Sita for doing an MC. And thanks to Anna Strinika for a beautiful innovation in beautiful song at the beginning. And more than session, I think the question and answer session was more like a consultation. I think thanks Reggie for making it as a free consultation for all the participants. I think everyone asked all their doubts and get a free consultation from Dr. Binoy John, an expert in heart. Thanks for that. And thanks for all the Rotarians. We have almost 40 plus participants participated in this session. Really a very good session. Well spent Sunday evening. Thank you all. Thank you.
And we also had people participating through Facebook as well. So Reggie may know the numbers there.
Yeah, many people, in fact, ask me for the IDs to join in and ask questions too.